Normal physiological changes in pregnancy. Firstly, we are going to look at the renal or the urinary system. So here, the clinical findings includes the increase in GFR and the renal size. Next, there is decrease in the blood urea nitrogen as well as the serum creat. So now looking at the mechanism of this, it is due to the increased cardiac output and the renal blood flow. This is due to the progesterone, and along with there is increase in renal excretion. Next, looking at the urinary frequency, and there is also nocturia. This is simply because of increase in the urine output, and there is the sodium excretion. Now looking at the mild hyponatremia, the mechanism being there are hormones of reset threshold. This is to the increase in ADH and release from the pituitary. Next, the system we are going to look at is heme, blood. In case of the dilutional anemia, it can be seen. The mechanism includes increase in the plasma volume and the RBC cell mass. Next, there is also the prothrombotic state. This includes a hormone mediated. There is decrease in the total protein S, antigen and the activity. There is increase in the fibrinogen and the coagulation factors. Next, looking at the cardiovascular system, here there is increase in the cardiac output as well as the heart rate. Mechanism being there is increase in the blood volume and decrease in systemic vascular resistance. Next, looking at the pulmonary, there is chronic respiratory alkalosis, and this is with the metabolic compensation. This increases the PaO2 as well as decreases the PaCO2. Here, the mechanism, it being there is progesterone, it directly stimulates the central respiratory centers. So what this does is it increases the tidal volume and minute ventilation.